boy.
Look away. We can't look away from her viral pimple popping videos. Say that 3 times fast. Now she's here to teach us everything she knows. I am going to be a board-certified dermatologist by the time this is all over. Please welcome Dr. Pimple Popper herself, Dr. Sandra Lee. Dr. Lee, thank you for joining us. This is like, today pretty much should be it should be the final show for me. Just let me retire.
She's going out with her favorite sport.
Yes.
And
yes.
Dr. Sandra Lee, and I'm done, and I'm out.
So, where do we begin? Dr. Pimple Popper, tell us how that nickname began for you.
It just happened out of the blue. I was just posting videos showing my little window into my world as a dermatologist, and then I posted a Blackhead Extraction video.
And
for some reason, people were interested in it.
Dilated pores are my favorite.
Yes,
you
dilated pore whiners. Yes,
giant.
I have one that comes
she's very well. She is a board certified.
One comes all the time here, and it's nice to get out like a little slinky, like a little.
How come you don't
see it
share
right
that?
now? Is there anything in there? I can't see that far. Dr. Lee?
We'll see.
Yes, but so it just happened that people were interested in it. I thought that was really weird, and I did it. I posted another one, and it just blew up. And look where I am.
I think I was there from the beginning. I'm not kidding, because remember when I broke my foot? It was several years ago, and I broke my foot, and I couldn't really do anything, and I don't know how I stumbled upon it, but I stumbled upon it. And then once you find one...
Yes, it's a slippery slope, it is.
And that's it. So,
and they keep getting bigger and bigger, and so you're a soft popper in the beginning, then you become a hard popper.
Well, those lipomas, let me tell you something. I'm not even sure how they happen, but I want in. I want to assist you in some way.
But assist, no pun intended.
Right.
When is it okay to attack the pimple? Because don't touch it, touch it.
Right. You know, I'm going to be like every other dermatologist and say don't pop your pimples, because there are risks. There are risks of infection and scarring and things like that, but I know people are going to do it. So I feel like it's my responsibility to tell you the most ideal time, and that would be when it's the most superficial. Yeah. Because that's when it's like a pustule and it's ready to be expressed out, because you're going to traumatize the skin as little as possible and not create a scar, because that's not what
And then when do you suggest we would see a dermatologist for some extraction?
Well, you should see one. Certainly if you have a deep one underneath there and you have a big event coming up, that's the one. Those are the ones we inject. And they go away within 24 hours. That's amazing, yes.
I love having them injected. It's my favorite. I wish you were my neighbor. I really do. I'd be at your house every day.
She would actually try and create pimples just to have you go in and take care of them.
I do have people that do that. You are not alone, let me tell you.
I've been trying.
Yes.
Have I not been trying? I've been trying
Rub in lard, get a big tub of lard.
That'll do it.
I tried the lard because I Googled how to create a pimple.
How do we properly pop a pimple at home?
Well, you want to certainly have clean equipment. If you have equipment, you want to have clean fingers, certainly, and steam your skin. That's always nice, but I use a comedone extractor. You've probably seen these before.
Yes, of course. This is I have my very own.
So this is a Schomburg type comedone extractor that I use, so it really has a rolled border and it's less traumatizing. Also,
you get rid of those blackheads.
Yes, the little sebaceous filaments.
Yes, and why is it that older people, why do their, you know, particularly the nose, why does it become so...
thickened or like pores?
Thickened and porous.
It depends on the type of skin you have. If you have oily skin, you're more prone to that. You can get something called rhinophyma, which we see on our channel, which does not mean that everybody gets that, but you get really dilated follicles and a lot of oil produced. Also, older people get a lot of blackheads and whiteheads. They're called solar comedones in that sense, and they get them around their eyes, so those are the big, nice ones that you want to express.
I want to get
ready.
in
She's going to hold on to these things.
Right, get excited, because we're going to take a break. We're going to come back, and we are going to practice popping pimples with Dr. Pimple Popper, Sandra Lee, after the break. You look completely perplexed.
So that can't be a lipoma, right? Because she's very thin to have a lipoma.
Well, you can have a lipoma no matter how thin you are.
Oh,
but
really?
hers is different because it's actually under her muscle. Because she moves her arm and it actually pivots under there. And so that's not my domain. I stay above muscles.
Above
my domain as a
dermatologist.
dermatologist.
Scene from Dr. Pimple Popper, the show.
I thought that lipomas only affected people that were
No, they actually don't grow and shrink according to your weight or a weight loss. lost. So it's like a little
Kelly,
utopia.
we're going to take away your certification.
You know what?
Like
I Googled.
I mean, here, you know,
I was
please,
convinced
board.
that I had a lipoma on my eye, so I Googled it, and I was like, okay, it's not.
But you know what's really exciting is that, so that was before the pop, where we're actually going to have a new series now coming up December 21st, the Monday. That's the whole new series, the original
Pimple
Dr.
Popper?
Pimple Popper.
I will be there, as
We
you
have
know.
amazing
I will be
patients.
there.
Doc, let's do
Amazing
this.
patients.
Where do you want to begin with our...
Okay, we're going to do surgery today. So we are going to start with, I think, our cyst here that got inflamed as it was sitting out, as
The
you can
cyst
see.
looks delicious, I must say.
It tastes delicious if you dare. So you guys are going to get to experience your... I know she's ready. She's going to experience your first pop, you guys. She's all... Look at her. This is the proper way. This is how a dermatologist prepares for a cyst surgery. Look at her. She's got her splash mask on, her gloves.
Thank you, Dr.
She's
Lee.
properly protected, you know.
She'll see at the convention.
Yes.
And I can like...
You can do... So what you want to do is it's interactive. You can squeeze the cyst and get sure. This is
Bare
what
hands?
it's like. Yeah. This is what it's like.
So good.
And this is the part where Dr. Lee
Yes,
says,
you can eat
"Am I
it. It tastes
hurting
really
you?
good.
Am I hurting you?"
Yes. Yeah, I'm not hurting you, right? Yes, that's
You're
right.
very good about asking your patients if they're in pain.
Well, it's really important to make sure they have control, because you're sitting on a table and you're like, you know, you're naked or and you're in pain, you know, you got sharp objects above you, so you really want to make sure people feel good.
And where's the best place to dispose of this?
In your mouth, maybe, in this case.
Okay.
But yeah, you don't have to do that, obviously.
All
You've got a towel there.
I mean,
you have a mask on.
Yeah, what flavor is it?
It's like vanilla buttercream. It's good. It's good. It's delicious.
You're just jealous.
Yes, right. So do you want to pop mine too? I saved mine for you.
Yes, I do. Thank you very much. Thank you, Dr. Lee.
You're welcome. She did such a good job. I know she wants to get her
By the
throat.
way, we're all going to leave, close the place down. She'll be here in the studio with the flashlight.
I just, if only this was a person.
Yes.
Let's get to the Blackhead. This is a Rice Krispie treat.
Yeah, this is really fun too. These are our Blackhead Rice Krispies that we have, even kids do, because it's nice that they get the satisfaction. You want to use one of your comedone extractors, and you just want to squeeze these. You're probably going to traumatize the skin surface a little more than a person. And you get your little blackhead.
So the pressure pushes it up, right?
Yeah, so that's what you. So it kind of teaches you proper technique too. But she already knows her technique, so she's got it.
I mean, because I watch these videos, so I'm a board-certified dermatologist.
Yes, but in this case, you could actually eat it, but you don't want to do that in real life, as we all know.
Is this?
So
let's see what flavor. Let's see what flavor this one is.
I love her. I love this. Yum.
It is fudge. It's delicious.
Yes,
Doctor, great to see you. Thank you for coming on.
You're
You
so
can see
welcome.
Dr. Pimple Popper before the pop airs Thursday at 10 p.m. on TLC. Thanks, Sandra.
Greatest day ever.